Hello again, everybody. This is Steve Callis, sports editor of WestchesterCountyPost.com. I'm here with the publisher of WestchesterCountyPost.com, Janelle Albritton, who has a master's degree in public health. And we're here to talk a week later about the latest on the coronavirus in the U.S. and partly around the world, and more specifically about high school sports, just high school in general, whether kids should be going back or not. As you know, it's a countrywide thing now, and because of the pandemic, up to 60,000 cases a day now all across the country, it raises different concerns in different areas of the country. But we're here to talk big picture and also narrower, especially with respect to school and high school sports, of course, within the school curriculum. So I'll turn it over to Janelle Albritton to get her thoughts on the bigger picture, and then we'll talk some more about it. Janelle, up to you.
All right. So as we were discussing before we went on the camera, is that in Wisconsin, the Supreme Court made a ruling back in May to overrule the governor's decision to put everyone on lockdown, saying it was an overreach and that was never the intention of authority for a health official, even if it was important in the case of a situation like COVID. And a point that was argued was, well, that's why it's called novel, because it's the first time we're seeing the situation. So of course there's no precedent for this. Of course it's unprecedented. But in the end, the governor was overridden by the Supreme Court. And so now he cannot really compel the people in Wisconsin to abide by a stay-at-home order. This is a bit of a flip situation, a reverse situation of what we saw, for example, in Phoenix or in Georgia, in Atlanta, Georgia, where the mayors wanted to do a lockdown. They wanted to mandate masks, for example, and the governors said no. They overrode the mayor. And, that's how our government is set up. We've got these different levels of government where the higher level overrides the lower level. And up until now, it seems to have been working fairly well. But in the last few months, it doesn't seem that the decisions being made are for the greater good or the health of the people. And as a public health person, it's a little difficult for me to hear people say that they want to exercise their God-given constitutional rights to not wear a mask. To which I say, okay, you can choose to not wear a mask. Maybe you won't be compelled to wear a mask, but you're not going to shop in Costco. And we saw a particularly ugly scene that you may have seen going viral on social media. A 77-year-old woman sitting down on the floor right in the middle of the exit lane at Costco because she wanted to return something, and they asked her to put a mask on before she could get her transaction started. And she threw a tantrum right there on the floor. And it's a little embarrassing. I mean, my parents are turning 77 this year, and I can't imagine. They're so dignified and lovely. I can't imagine either one of them behaving like an angry 4-year-old. But there you have it. So we've got no clear message coming from all levels of government, and the confusion that is ensuing is translating into a death toll, plain and simple. So for the last few days, there's been a bit of a flap, attempts to discredit Dr. Fauci and so forth. That's really not what this video is about. But my point is to say that there's quite a lot of confusion for people who really don't know what to do and don't know how to do their own research themselves in finding out, what does a mask really do? Does it really help, etc. So for some helpful links, or links that I hope are helpful to you, please check out the sports and wellness section on westchestercountypost.com. I'm posting helpful links dashboard links, statistical things that you can look and see for yourself and make your own decisions. But I hope that you decide to actually just wear a mask, because if everyone wore a mask just for a few weeks, we would be in a much better situation a few weeks from now than if we didn't take that course. That's about it for now.
I would say this briefly on masks as opposed to stay-at-home orders. As an attorney, it just strikes me as absurd from a legal perspective. The main modeler out in Washington, the state of Washington, who the White House follows religiously and has from the get-go, just came out last week with a model that said if everybody in the country wore a mask, if 95% of the people wore a mask, we would literally save 40,000 lives between now and I think November 1st. So I question even the Wisconsin Supreme Court when they say, oh, I don't really know if you could do that. That's really an overreach. But the question becomes to me, well, how many dead people will you allow before you'll say it's not an overreach? And I'll go all the way back to 1918 to the flu epidemic then, which killed 675,000 Americans and many millions worldwide. Doing research there, I looked for some Supreme Court cases. There were not, these issues were not litigated 100 years ago or 102 years ago. But I will say this, when you read about that flu, and I'm sure you know this, Janelle, back then people would get the flu at 9 in the morning. They might drop dead literally at 3 in the afternoon. If they made it to the next day, they were like lucky. And we're talking about hundreds of thousands of people, which we may be talking about in the United States in a few months, if your predictions and others that it'll get up to 300,000 before the end of the year.
That's my prediction, that we'll have 300,000 dead by Christmas, possibly Thanksgiving. I hope I'm wrong, but looking at the trends, and this is why I was having such a hard time back in March, seeing the systems fail that I never thought would fail in this country, and predicting in my mind, calculating, the scenarios. And it was not hard to see the scenario that we're in now in mid-July, and in even worse scenarios in the weeks to come.
So I think, just getting back once more to the Wisconsin Supreme Court, I think the way maybe to present that was, if you allow the stay-at-home order, which you should, the governor should have the power to do it, et cetera, how many lives are you willing to give up? 10, 20, 50, 100,000? Because stay at home, I'm sure you would tell me, is better than just wearing masks. And if wearing masks will save 40,000 lives throughout the country in the next 3 or 4 months, it just strikes me as an absurdity when the history books are written on this. And I'm not talking about just from a legal perspective, but from a common sense perspective, where you say wear a mask. It sounds so simple. And again, now we're from New York. We live in New York. We stay in New York. We saw the horror of March and April into May.
We were right next to the epicenter of New Rochelle, where the one man, a lawyer, by the way, those lawyers, didn't know he was infected. He was not feeling too well. He did go to the doctor more than once, was not tested or diagnosed because the test was not available at the time.
So just to put a bow on that, and then to get to high school sports, I think finally the way it's going to be looked at is, what were these people thinking? There's a common sense element to all of this that's being ignored by the president for whatever reason. I can't believe it's not manly to wear a mask, and all his acolytes, for lack of a better word. And this has really put us behind the 8 ball, and this is why we can't get our arms around it. Anything you hear about schools opening with no problems in Denmark and Norway, anything you hear, no country has opened up with as high a positivity rate as we have in many states, with as high as 60,000 cases a day. It's just absurd to say because they did it and it worked that we're going to do it. But let me bring that closer to home.
That's a lot like the high school party animal who didn't ever study for his exams and barely scraped by and got his diploma, complaining that it's not fair because the valedictorian is getting so much, attention.
No, that's a good analogy.
You got to do the work. You can't compare us to Scandinavian countries who, by the way, have socialized medicine, where the cost of accessing medical care is next to nothing. So they're not afraid to go into the doctor if they're not feeling well. And there's a safety net so that if they are sick, they're not going to lose their housing. So there's
But,
that.
but that's another video for another
Right.
time. Bringing it all back to high school sports, or even kids going to high school, which you can talk about better than I, Janelle. Um, just today, the New York State Public High School Athletic Association uh, ruled that there will be no, originally sports were supposed to start in New York State and high schools on August 24th. And uh, as we're shooting this now on July 15th, it just seemed too close. And sure enough, today they finally came out with there will be no school sports. And again, the school going back to school hasn't even been determined yet in New York, but there will be no school sports until September 21, which is, you know, legit 4 weeks after what was originally planned. Now, there are also already rumors, or certainly scenarios, as they call them, that they might wait all the way until March to play like football, which is going to be a hard to physically distance in football when you have linemen hitting each other 50 times a game on both sides of the ball. And that doesn't even take into tackling ball carriers and quarterbacks, et cetera. So I certainly think they've done the right thing. I think it's still an open issue, and the people that I've spoken to in both New York City and in Westchester County are very reluctant to send their kids back to school. And frankly, my kids are older. I totally understand. I'm thankful I don't have to make that kind of decision.
Yep.
But I think I would err on the side of caution. And even though we all agree that it's better to be in class from a learning perspective, which I'll defer to you in a second on, I think it's better to be safe than sorry. It's still not clear. As we talk about, a coronavirus is a new virus. Nobody really knows. We're learning things every day, every week. But I think in terms of sports, I'm glad they put it back a month. I believe they'll wind up putting it back until January at the least. The best scenario I see, and we can talk about it later, is 3 short seasons that begin in January. And hopefully by then we'll either, I don't know if we'll have a vaccine, but we'll have a therapy, or we've got it under control, maybe nationwide, maybe I'm dreaming. But I think to push it back is best. And look, even the Big Ten college football commissioner said, we may not even have a Big Ten college football season this year. We don't know. And I think that's probably the smartest thing I've heard any of these sports guys say, because it's a week-to-week thing. It's not a month-to-month thing. And the final thing I'll say on New York is Governor Cuomo has said that in the first week of August, which is just, you know, a little more than 2 weeks away from now, he's going to make that final decision on schools and on sports. So I'm sure we'll be back again with those results when they come out. But I'd rather hear from you, Janelle, about the whole bigger picture with schools in general and what's going on. Because my anecdotal evidence with a number of parents is, yeah, I think we'll wait and see what happens.
Well, so I have a number of friends who are teachers, and there has, especially in the underserved neighborhoods, the school facilities are not exactly modernized. So there are windows that don't open. There are rooms that are not air conditioned. And even if they were air conditioned, it's not HVAC, it's not central. And even if it were, it wouldn't be set up with UV lights to help disinfect the circulating air. So there's that. There's the environmental aspect of it. I worked briefly in a public school in Harlem, grades 1 through 4, that I went into to use several of the bathrooms around the building, and none of the bathrooms had soap. So I'm not really sure what the hygiene situation is for the children to be practicing good hygiene. I was told that was an ongoing issue at that particular location. So maybe that's the only school that has that problem in all of Manhattan.
Hopefully, but unlikely.
And then you've got children going home to maybe crowded conditions with multi-generational situations, as are 20% of the households. So there's the environmental factor. Then you've got kids who have special needs. I was in my research today, I found that the kids at the end of this school year are already 7 months they'll be 7 months behind by the time fall begins. The equivalent of 7 months, because they didn't get the help that they needed starting in around February. You've got children who are special needs, who may have, ADD or, other intellectual disabilities. Then you've got kids who are physically challenged, they're in wheelchairs and so forth. Maybe cognitively they're fine, but they've got special needs physically and medically. And so it's really hard to take care of these special needs kids at home who probably don't have a full-time nurse at home. Let's just keep it real. So for parents who are the lucky ones who are able to work from home, how do you hold down your job working from home and homeschool your child at the same time? If both parents are home working from home, who's going to homeschool the children? And if you're a single parent, even worse, like you can't even alternate and take turns. So there's so many issues going on with the children. And I keep seeing Governor DeSantis of Florida say that the infection rates of the young children are very low, 0.5% or lower, and we've got to open up the schools. So in essence, he's saying, the X number of children are going to be sacrificed, and they're worth the sacrifice to get the schools open again. As a public health professional, I really have a hard time with that rationale, because a core goal of public health is to prevent the preventable, prevent preventable deaths, prevent preventable disability and disease. And remember that even if someone gets COVID and recovers within a few weeks, there are possibilities that there are long-term effects: heart damage, lung damage, internal organ damage. Don't assume that just because someone survives COVID, that they're fine. Trump once, he mentioned that 99% of the cases, they're just fine. It's fine. He was very dismissive of that. And I don't think it's 99%. Even if the death toll was only 1%, and the other 99 who didn't die, we're grateful to still be alive. Of course, again, because it's a novel virus, we don't have data on this long term, but we will in a few years, and we'll be able to track this and see what the long-term effects were from the organ damage of the virus. So we're going into this blind. No one can be right 100% of the time with a situation like this. And they can only lean on their training and experience, such as, Dr. Fauci has done a great job in calling the shots. And we just have to go step by step by step. But what we do know works, we have seen work, and we can take lessons learned from best practices in countries all over the world, such as Japan, which never had a shutdown, and other countries that have been COVID-free for weeks, if not months. So the US just seems, in general, the leadership seems to be unwilling to learn and apply the best practices that are working for millions of others on other areas of the planet.
So to tie into that, and then to bring it back to New York schools and sports, Governor Cuomo is going to announce in a couple of weeks what's going to happen. I don't really think you can talk solidly about the sports because we don't even know yet what's happening with the schools, but we will. But there are 6 scenarios that the State High School Association has put together, which I've reviewed them and think they're actually pretty good. Again, trying to figure out, they don't know what it's going to be. But I think the most likely thing, frankly, Janelle, and despite the pressure from the president, who just gets up and says, we want all schools to open, and Betsy DeVos says the same thing, and we're even going to put pressure on these people if they don't. Despite that, already in Los Angeles, which I think is the second biggest school district there from Los Angeles County, near where you're from, other than the New York City School District, they've already announced total online. San Diego school system, total online.
Which is something I forgot to mention, is that not all children have devices, and if they do, there's no money for a Wi-Fi in the home. So to assume that all children have access to the internet and they have devices that they can use to get their homework done, there was a stunning percentage of students in the New York City school district who never even logged in once.
Yeah.
And so that's where kind of the 7-month calculation comes in, where they are far, far behind their academic achievement, where they should be at this time in the year.
And having said that, Mayor de Blasio, and there's always that spitting contest for you New Yorkers between the mayor of New York City and Governor Cuomo, but he's already announced that you're either going to go to school 1, 2, or 3 days a week, which means you're going to be home either 2, 3, or 4 days a week, which causes all kinds of childcare problems, job problems. And again, look, I'm for the safety. I'm on record as saying if I had kids now, I would not send them to school. We went through the worst of it in New York. It's good. I'm putting that in quotes now. It's good now. But now you have one kid come back from Florida, go to his high school graduation up in Chappaqua, and poof, 10 days later, 27 people are infected. So we have to be careful of those kinds of things. But in terms of the sports, which is, of course, my angle, if they decide to open school, and I think they will, the question is how much of it will be in school, how much of it will be out of school. And you're right, that problem has to be solved with not just tablets or computers, but with Wi-Fi, of course, as well. And as you know, there's a lot of problems with the meals. A lot of these kids get 1 or even 2 meals a day. So
Yeah.
during the last few months in New York City, they worked it out so you could go get those meals for your children. But of course, the schools were closed.
Which was quite a commentary when, the school bus drivers are volunteering to drive food around along their routes because they know their children very well. These are like their aunties and uncles to these kids.
Right.
And they know which homes are food insecure.
So when you talk about frontline heroes, don't forget school bus drivers, because of course they're very important, which will lead me to my football analysis, which is a football team can no longer, everybody get in the bus, all 50 guys. That's not going to happen anymore. And frankly, the question becomes, can you do it with 2 buses? Maybe not. 3 buses? Who's paying for it?
You just triple the fleet.
Right. And
Yep.
that, and plus you have to get drivers. And as you know, a lot of those guys are older guys who, if they have, an underlying condition, they're at risk as well. So I think what's going to happen is there's going to be a decision in early August in terms of actual school. Sports has already been put off till September 21st, which I think is the minimum intelligent decision to make, because you don't know, maybe something's going to happen great in the next 6 weeks. I don't think so.
Why not just say October 1?
Well,
I guess psychologically it's still September.
I think because then maybe you can actually start a real season, early October, and maybe get something done by Thanksgiving, which will be a shorter season, 7 games. I'm talking about football mainly, although it affects a lot of other sports. And then Cuomo's going to decide what he's going to decide. Then the New York State Public High School Athletic Association is going to meet and decide vis-a-vis sports, which one of these 6 scenarios, which you can find online, they're interesting, but I think only the later ones, which either put sports off till January, not a bad idea, or flip-flop actual sports. So football would be played in March, and something like baseball would be played September 21st.
Yeah, but January's in the belly of flu season.
Well, and there's the
perfect storm.
That's pretty much it for me, but that's the final thing you can talk about, because the other problem, which we didn't talk about, and Janelle will now, is this assumes that everything is okay in November, December, January, February. But in fact, if you're a public health expert, you know far better than I what very well might be coming down the road, or almost definitely will be coming down the road.
Well, I'm not running any models or crunching any numbers, but based on what I saw in March, I did see the death toll going well over 100,000 within a couple of months. Because if you understand the mathematical principle of what a logarithm is, or what's logarithmic, it's not linear, it's logarithmic. And so if you double something again and again and again, you can go from 3% to 100% in 5 steps. And if you think of it that way, it doesn't really matter what the numbers are. It's a matter of the percentage. So once you hit 100%, then what? We've already got fully saturated hospital systems. You know, here in New York, even people were dying at home of heart attacks and strokes and things because they weren't even calling the ambulance because they didn't want to go into the ER and risk infection. And even if they did call the ambulance, there were quite a few EMTs who had to make hard decisions to either help resuscitate the patient or not. And there was even a point in time when EMTs were told to not do CPR.
Right. Terrible.
Partly because of the risk to them to contract COVID, because you don't know if someone in the household has COVID or if the patient has COVID. And so basically there are many stories coming out of people who just simply, you know, felt chest pains and kissed their children and lay down and died because of COVID. So we may never really be able to calculate the death toll connected to COVID, but my prediction, and I hope that I'm wrong, but based on all this infighting and the White House's determination to discredit Fauci and run the hospital data around the CDC straight to HHS, which is under, you know, a little more closely under the control of the administration, we won't even know what the real numbers are when the CDC stops getting the data. So we'll be blind, and it will, whatever data that we hear about will simply be part of Trump's reelection campaign. So just remember that I said it, and whatever the news says, I may still be right. I hope I'm wrong, but we're already pushing 140,000. That could easily double in the next few months. We could easily pass 300,000 by Christmas, if not Thanksgiving.
So we'll leave it there for now. Until the next time, and there'll be a next time. This is Steve Callis, speaking of sports, along with Janelle Albritton, the publisher of the WestchesterCountyPost.com. We'll see you the next time.